Hi, I'm Dr. Sam Curtis, and today we're going to be talking about SPD, Symphsis Pubis Disorder. So most commonly, if you have SPD or if your OB has told you have SPD, you're probably in your second, third, or fourth or more pregnancy. It's not as common in your first pregnancy, but let's dig into some physiology. So, symphysis pubis is actually a joint at the front of your pelvis. So we're pretty familiar with our SI joint. It's back where your sacrum articulates with your hip bone. The front of your pelvis is actually another joint, and it doesn't move as much, theoretically. So what it does is it comes together just like this, and it connects. There's a little bit of cartilage in between the two bones. Now, as you get pregnant and go further in your pregnancy, the weight of your baby, as well as relaxin in your body, will start to separate that joint just a little bit, which is always helpful because it gives you more room for baby to get out. Now, postpartum, after you deliver that baby, within the first 6 months, that joint is going to come back together fairly quickly. If you breastfeed, which we are huge supporters of here, you're gonna have a small amount of relaxin in your body throughout the time that you breastfeed. That joint, as it comes back together, can come back together misaligned. Not terribly so. If it is terribly misaligned, then that actually becomes a different scenario. But this is talking about very subtle misalignment. And this, the symptoms of this are most common in early postpartum, when a woman will come in and she'll say she takes a step and she feels like her hip is about to give out. Or she'll have shooting pains in between, like from her thigh to her knee. And those are actually your adductor muscles. So another little tidbit, your adductor muscles, which allow you to pull your legs together, or if you absolutely hate doing lunges, that's most likely why, those muscles actually attach to the symphysis pubis joint. So what we're looking at here is in second pregnancies, what will happen is when that baby starts to get bigger, that joint that was previously irritated actually gets irritated earlier in pregnancy. With that, we can actually do a lot of hip stabilization work with your sacrum, with your lumbar spine, with your hips. That definitely helps out. In our office, we do something called Webster technique, and that is a non-osseous form of adjusting the pelvis that makes sure that everything is moving side to side. Now, when your pelvis is moving the way it's supposed to, theoretically, any issues that you had in the front would also be accommodated. It wouldn't flare up. It wouldn't be painful for you. So that's our first thing that we look at. Second of all, we start to work on some of those exercises that expose the weak muscles, i.e. lunges. Lunges are a great exercise to do in pregnancy because, again, those muscles are pretty important for labor and for actually delivering a baby. And lastly, in our office, we do have some belts that we recommend if the SPD is bad enough, especially in multiple pregnancies. So if a woman has twins or triplets, that can be a huge issue as well. So we want to work to make sure that the pelvis is functioning as best as possible to make sure that the posterior aspect of the pelvis is moving, as well as that front joint as it starts to separate is nice and balanced. And from there, generally speaking, the pain is significantly reduced. The other interesting thing about SPD, and I didn't learn this until I was in practice for myself, is that a lot of times women will come in and they say, oh, my low back hurts. And we say, okay, let's check you out, and come to find out her low back hurts because of an instability of the symphysis pubis joint. So it can kind of manifest in a bunch of different ways, but if you're having issues with low back pain, or if you're having that shooting feeling down into the middle of your legs, like into your groin, or if you're having just straight up pain right at the very, very center of the bottom of your baby belly, let us see what we can do to help. Thanks, guys.